Hello everyone, I am Dr. Talha. Before anything else, I want to thank each one of you for your continuous prayers and kind messages for our little fighter. Every day, every word you send, every thought you share truly strengthen both our team and the baby's family. Today's update is about the same baby we discussed yesterday, the fragile newborn who has been battling multiple infections including Acinetobacter, Klebsiella pneumonia and Candida, along with severe ventriculitis, hydrocephalus and sepsis. In today's video, you will see something that might look simple, but in reality, it's one of the most difficult tasks in neonatal care, passing an IV line. Our nursing staff is trying to pass an IV line in a baby, and you people can see he is extremely weak and low birth weight and fragile. In such kind of babies, the veins are almost invisible. You can see your screen paper thin and collapsed as soon as the needle touches them. Finding a good vein becomes a challenge even for the most skilled hand. Many people in my yesterday session commented and taunt us and saying that you people cannot pass an IV line or you are just torturing the babies. But my dear friends, that is not the case you are seeing. We understand your emotions, we really do care about that. But every single prick, every procedure you see here is done with care, compassion, and medical necessity. These tips are not cruelty, they are part of baby's survival journey. So keep that in mind. Without an IV line, we cannot give life saving medications, fluids, and nutrition. Without it, the baby's infection would worsen and recovery would become impossible. So, yes, it is painful to watch, but this is the reality of neonatal critical care, where every small act, even something as routine as passing a line, can decide between life and death. Each successful IV insertion in such weak babies isn't just a procedure, it is a symbol of persistence, patience, and hope. Today, the baby is on NPO, which means no oral feeding for now. The reason is that we are preparing him for a very important and delicate surgery, EVD, or in simple words, external ventricular drainage. Now, let's understand what EVD means. EVD is a life-saving procedure performing in babies who develop hydrocephalus, a condition where fluids called CSF, cerebrospinal fluid, build up inside the brain's ventricle, causing pressure on brain tissues. In normal people, normally this fluid flows through the brain and spinal cord and then gets absorbed into the bloodstream. But in infection like ventriculitis or severe meningitis, the fluid pathway becomes blocked or inflamed. This leads to increased pressure inside the head, and if left untreated, it can damage brain tissues permanently. So in EVD surgery, a small soft tube is carefully inserted into one of the brain's ventricles through a small opening in the skull, and that tube drains out the excess fluid, as you can see in the head of the baby. The tube when inserted into the head of the baby, so the excess fluid goes to an external collection bag, allowing the pressure to decrease, giving the brain space to heal and the infection to clear up. So what should we need before EVD surgery, a pre-operative care? So before the surgery, The professional medical staff make sure the baby is stable, monitoring his temperature, his states, his blood sugar, and infection markers. IV antibiotics are given on time, fluids are adjusted to maintain hydration, and the baby is kept in PO to prevent any risk during anesthesia. We also ensure the environment remains sterile before infection control, before neurosurgery is absolutely critical. All some of these talks were related to surgical ward or operation theater. So now let's talk about after EVD surgery post operative care, how a professional nurse or professional staff can provide a post operative care to EVD surgery baby. After the surgery, the baby is closely monitored in the NICU. We check the EVD tube site frequently for any sign of leakage or infection. All these improvement, and I will also show you a post-operative care of this baby when he came back from EVD surgery. Now let's move forward. A message for all mothers and families and expecting mothers, a prenatal awareness. Many of the complications we see in the NICU can be reduced with proper prenatal care. Expecting mothers should attend regular antenatal visit for monitoring, take prescribed supplements like iron, folic acid, and calcium, ensuring vaccination and infection screening are up to date. Maintain good nutrition and hygiene. Avoid self-medication or unprescribed antibiotics during pregnancy. And above all, awareness matters. Educate every woman around you. A mother's health before and during pregnancy directly shape her baby's future. As you watch this video, so please remember, behind every small moment, every vein found, every surgery planned, there is a team working tirelessly for one fragile life. These are not just medical procedures, they are stories of hope, courage, and teamwork. And to all parents watching, take this as a reminder to value antenatal care, early medical attention, and emotional support, because miracles happen, but they need science, compassion, and prayers working hand in hand. If you would like, I can share a detailed video soon on EVD care, treatment plans, and the medication using for this little one. Let me know in the comments below. Thank you.